What is your name? What are you doing around?
Okay. As the scholarship program coordinator for the ELAM scholarship.
What is alum?
ELAM is a school in Cuba that was founded in 1999. It's basically a international medical school that has trained over 30,000 physicians for the world. After it was founded, there was a group of Congressional Black Caucus members that visited the island on a tour that was led by Reverend Lucius Walker. And that tour led to these congressmen and women witnessing what the Cuban healthcare system was like, and also witnessing the amazing work of ELAM. And the fact became very real for some of the members of that congregation that if they were training people to be medical doctors there for underprivileged, underrepresented populations, this is something that we could benefit from as well as in the US.
What did you learn in Cuba?
Medicine is one thing, but it's much more than that. I learned a lot of humility. I learned to be more personable. I learned to be myself. And I felt accepted as myself. And I say this because I'm coming from a context of a Muslim African child in the United States, having to assimilate for so many years in ways always kind of engaging with this struggle of identity, of asserting yourself in a place that was very Islamophobic and very anti-African. And this is what I had to go through for many stages of my life. So when I got to Cuba, it was like I could breathe. I could be myself because I engaged with people who actually genuinely wanted to know who I was, what my family was like, where I came from, our traditions. And all this may be very elementary for most people. It may seem like this is very trivial. But for somebody like me who struggled with being accepted and being valued as I was without having to change into something other people wanted me to be, this was what really inspired me. And it taught me a level of tolerance because I had to then also emulate that behavior with everybody else that I was going to school with. People who were coming from all sorts of places. And our Cuban friends, our Cuban professors, everybody who was around us was engaging with us. And really, we had a family. They taught us to respect each other. They taught us to lean on each other and support each other in a way that I had never experienced before. Because everything here is about me, myself, and I. I was able to meet people who were very natural in the way that they're able to build kinship with people that they don't even know. To stand in solidarity with because their struggles were important, just as my struggles were important. I don't think there's a way to quantify these things. And this is not what you learn in the classroom, in the textbook. This is from struggling in the dorms together, living under tough conditions. The time it takes for us to go from point A to point B in Cuba is much different from anywhere else in the world. But to see every day our profes and everybody is busting to come work and give us their all. They make themselves available. They invite you to their homes. They go above and beyond. And it's not because we have to pay them for it. It's a different mindset that you have a tia who brings extra eggs from her house for you because she knows you're vegetarian and she's worried that you're not eating enough. That's my story. The patients everywhere, in every level of our learning, they trusted us. They saw us as people who were learning and that they needed to be open to us and help us get better at our skill. I learned to stand very firmly on my convictions. I say that is because I learned that the Cuban brand of patriotism is not anything like I've ever seen before in a people. And it's not about just waving a flag and standing behind it. It's about knowing your history, your ancestors, knowing the sacrifices they made and standing behind that, standing behind the value of that. Those are things that impacted me and drove me to digging deeper about who my ancestors were, what our struggles and our sacrifices were.
Is the medical education that you received in Cuba as good as the United States?
Well, I didn't go to medical school here, so I can't really speak on that. But I can say, compared to what I have learned from people who do go to school here, who do attend medical school here, yes, I think it is as good, if not better, than here. I say that not because I'm partial, but because I know that Cuba gives us, in our medical education, a variety of tools to be able to serve our communities. I say this because, number one, the US medical education is very much disjointed from the public health education. Here, for people to be engaged with public health on the level that we learn in Cuba, you have to probably sign up for a master's in public health course. Whereas that is built into our education in Cuba, because you learn disaster medicine, you learn public health as part of your curriculum. You learn community medicine and how you're supposed to engage with people who are around you. For example, if I know my patient population is high on cardiovascular disease, smoking is a high risk factor in that particular population, I know that that community has different priorities that I need to tackle as a family physician that's trained in Cuba. Here, it's not the same. Yes, you know that smoking is a risk factor. You know that your patient maybe has heart disease, but that's one individual. You're not understanding what all the environmental factors are. What are all the contributing factors to why that person is manifesting in that way?
When was the first time that you hear about Cuba?
I was 15, actually. We were riding in the car. It was on the radio that there was a medical school that was now open in Cuba that was offering scholarships for youth to study medicine. I was with my dad, and my dad was the one who then started to tell me more about the Cuban presence in Africa, and because we're originally from Ghana. And so there had been Cuban doctors in Ghana for many years. There had been family members who studied in Cuba in different fields. So there I get to learn more and more about who Cuba is and what Cuba is to, number one, African people, particularly Ghanaian people, and then what its impact in the world has been. And for me, at that age, what I realized was that if Cuba was training people who were doctors that were willing to go to rural areas and serve the people, that's the sort of doctor that I wanted to be. I wanted to be a doctor that was trained in the type of medicine that would be practical to my people, because I don't come from a community that needs a lot. We just need a lot of care. And the type of training that I would get in Cuba would give me the tools that I needed.
Are you practicing medicine right now?
Not yet. I am in the process of preparing for the United States medical licensing exams while I'm working with IFCO Pastors for Peace as the program coordinator for the scholarship program. I'm very proud to say that U.S. alum grads are a rare breed of human. Before we go into the program, we come out with the hopes that we can serve our communities when we come back. And a lot of people do. They're trying to take care of as much of the population that is uninsured, that is poor. And that's what this program is about. It's about filling the gap, even though it's not going to solve the bigger problem that we have in the system. But we are a piece to the solution. I have talked with some graduates who have plans after fellowship of starting free clinics. So these are the people that we know our profes would be proud of. If you haven't heard of an Elam grad yet in the United States, don't worry, because Elam graduates are in over 30 states at this point. And this is a big country, but we can change this place and make a system that is more humane.
There is a way that you can find the kind of scholarship to study medicine here in the United States?
No. On the level that we're doing it in Cuba, no. Lately, especially after, I would say, 2014, there started to spring up these medical schools that were offering tuition-free medical education. There are quite a few. Now the numbers have grown, but again, here in the States, you're not just going to go to school and pay for tuition. You're going to go to school and pay for room and board. You're going to go and pay for all these other expenses in terms of your materials that you need to study. And not only that, these scholarships are very limited and they come at a very rigorous and competitive pace. And that is all a deterrent for any poor child, any working class child, any child of color who has already had to surmount so many obstacles in this educational system. This educational system from elementary school tells brown and black children that they cannot aspire to be a doctor, a lawyer, all these things, right? So you have to overcome all of that, get to the university level, finish your undergraduate education, and then apply to medical school. After you've taken maybe a medical entrance exam, some schools are waiving that. But again, the cost is not even just the tuition that we're talking about. The difference is profound for Cuba. Cuba is a system where from elementary school until higher education, you can go to school for free. And not only that, you're going to school with basic supplies, like your uniform provided for, your books provided, all the basic materials that you really need as a student to thrive. That is not the system we live in here.
How is possible that you have a free scholarship in Cuba to study medicine, that Cuba is a really poor country and you don't have that kind of opportunities here in the United States?
Cuba has its priorities straight, number one. And Cuba's decision to even offer a scholarship like this is not surprising to people who know the Cuban reputation, because it precedes 1999 and the founding of this school. So when we talk about guaranteeing health and access to education, and that commitment has come from the time Cuba decided to invest so much of its work and reputation in going out to the world and providing health and care for people in different countries. That's how the school was founded after Hurricane Mitch and George had ravaged parts of the Caribbean and Central America. And what ended up happening is that, yes, Cuban medical professionals were sent out there to help in the places that were devastated, but they couldn't stay there forever. That was a temporary solution. So thinking about the broader problem, which is a problem that we're supposed to be tackling globally. It's not supposed to be just little Cuba trying to solve this problem. Cuba says, what can we do as a permanent solution for this issue of people not having medical care? They decided that training the youths from these poor communities was a better solution than sending personnel every few years to places like this. And that's how a school like this is running till this day.
Have you heard the accusations by the U.S. government about the Cuban doctors that go on missions around the world as slaves?
I've heard those accusations, and I think they are a huge insult to the hard work of Cuban physicians around the world. Those who are currently working and those who have been working for decades. Why? Because in all of my education in Cuba, almost all of my teachers completed some kind of mission abroad. I never heard anybody tell me that they had an experience of slavery. To me, I think the greatest insult is saying, for example, the doctors who went for the Ebola crisis in 2014, doctors and nurses and all the other health professionals, those 256 individuals risked their lives in a crisis that all the rest of the world was not willing to act so they could be slaves. It's illogical, but it just shows the lack of understanding of humanity that this U.S. government has. They are not able to grasp the fact that Cuban people think and operate very differently. They're not driven by the accolades, the prestige. They're not driven by the money and the profit of going to save people. They were doing it because they knew that the world needed them. The world needs them. People also were deployed in this pandemic to different places that they didn't know. We didn't know anything about this virus, if people are going to make it alive or not. But they were deployed and they went. That accusation is false, and it has to be crushed at any possible moment, because it just takes all the value out of the hard work that people put out there. These people would go out there and work for months and years, leaving their children behind, leaving their loved ones behind. No, they have to have a love for their profession, a love for humanity to be able to make those kind of sacrifices. And that is just one case of thousands of Cubans who have done that.
I'm so proud that you said that, because my mom is a doctor and my mom did missions in Venezuela, and she also left a child behind. That was me. And at the time, I couldn't understand, but I do now, and I feel very proud for her. And also, it is not a contradiction that I just want to get money, earn money with this medical missions, and at the same time you are teaching young people around the world just to take them back to their original countries. For me, it doesn't have sense. I don't know. What
It
is your
does not.
opinion?
It does not, because these are people who they serve in the missions, they come back home and they teach not only their own youth medicine, but all these international youths who are studying there. They teach them for years, because everywhere we go is a teaching hospital, a clinic, a medical office. They're teaching 24/7, something that is not done here. Everybody is a prophet. Everybody is invested in you becoming not only a good professional, but a good human being. I mean, to me, it's amazing. I was in Cuba, and if I wanted to buy books, they were so cheap. If I wanted anything when it came to enriching culture and my life as a student who's not working, doesn't have much money, but I enjoyed life because Cuba made it accessible.
In your opinion, what is the biggest difference between the Cuban health system and the US health system?
Cuba prioritizes preservation of life, and the US prioritizes profit. At no point in the Cuban system did I ever see anybody come to a clinic or a doctor's office come in and say, you need to pay in order to be seen for any kind of care. You walk in and you have to put your name down and wait. If you can't be attended to and you need a specific consult, they make an appointment for you to come back. Most likely, wherever you're being attended to is within walking distance of where you live. That's not the case here in the United States. Most of our people, especially from poor and underserved communities, get care in an emergency room. That is not the place to get care. You're supposed to get care at a primary level. You're supposed to get care beforehand, not when you're almost dying, you're having a heart attack, you're having your appendix ruptured. That's not when you should be first seeing a doctor. But unfortunately, that's the circumstance that we live in the United States. Why? Because every hour, every day you're hospitalized is more money on your bill. Every gadget that was used on you, you're going to be paying for that in the United States. So you could just wake up on any day in Cuba and go to the emergency room or go to your doctor's office and say, I just need to check my cholesterol. Can you can you make that happen? And they would do it. They would write you the referral you need to go get your lab test done. Who's going to ask you, you know, do you have money? Or where do you live? Or let me see your ID card. Like, you can be a janitor, you could also be the director of the hospital. Either way, you come to a place where you need care, you're attended to.
What is the best thing that you keep with you about Cuba?
The best thing that I keep with me about Cuba, aside from the coffee,
Hi, me too. I just want to bring coffee to the United States, please. It's so hard to live without Cuban coffee.
is laughing in spite of all the struggles and hardships. It's enjoying and valuing family, because who are we without family? It's feeling that I'm enough as a human being to be respected and valued. It's knowing that I'm building a possibility for somebody else, for my child, for any of my descendants to know that it's possible to be a doctor, to be anybody you want to be.